Thank you.
We will ask all event attendees to mute your microphone during the Q&A until we have a Q&A at the end. So you please put any questions in the chat. We are going to have time later to share these questions with our presenters. And Ivy Vineo, who's here with us, she's our traditional healing coordinator, will help with the Q&A. My name is Leanne Littlewolf. I use she, her pronouns. I'm the executive director for the American Indian Community Housing Organization, AICHO. And before we begin, we always start with the acknowledgement that we are on traditional Indigenous homelands. And right now I'm currently in the city of Duluth, which rests on ceded land acquired in a nation-to-nation treaty agreement between the Anishinaabe Treaty, our tribal nations, and US government. So after that acknowledgement, I just want to say I'm really excited to be here today to listen to Sasheen Goslin, who was most recently the AICHO Health Equity Director, on the topic of Indigenous approaches to public health education. Sasheen is joined with co-presenters Donovan, Doffing, Jenna, Olson, and Ann Graves, who will also do a more thorough introduction for themselves. And I will turn it over to Sasheen for the presentation.
Ani and Sasheen Indigenous Kaz, Miss Klabakan, Dindun Jaba, magazine and Don Dame. Hello, my name is Sasheen Goslin. I'm super excited to be here, but also very nervous, kind of nerve-wracking seeing people's faces. But we are here today to talk about our HIV Awareness Campaign with taking a specific look at the Indigenous approach that we used on this. Like I said, my name is Sasheen. I am Prairie Band Potawatomi and Red Cliff Ojibwe. I spent the last 6 years working in Indian country, taking a look at higher education, natural resources, and most recently, Indigenous health. I identify as an Indigenous scholar. I'm super proud of. I'm currently a master's student at UMD in the Tribal Administration program. Right now, I'm actively working to improve Indigenous health across the Midwest. We'll go ahead and introduce our co-presenters next.
All right. Sorry, I can unmute myself there for a minute. Thank you, Sasheen. My name is Ann Graves, and I'm a contracted project manager with St. Louis County Public Health. And I'm honored to introduce the additional presenters for today's presentation. Donovan Doffing, who is a public health AmeriCorps member, serving his public health term with St. Louis County Public Health. And Jenna Olson, communications coordinator with Carlton-Cook-Lake-St. Louis Community Health Board. By the end of this presentation today, you should be able to engage with community partners to develop messaging that resonates with targeted audiences, identify how the foundational public health capabilities of community partnership development and communications can be integrated into public health activities, and identify a variety of communication channels, including social media, that can be used to engage targeted populations and deliver the most up-to-date public health information and resources. And here is a list of kind of our larger team members and additional team members that worked on this project with us. I would like to particularly highlight our partners at Fond du Lac Human Services, Callie Bassett and Celeste Eckberg, who were part of our core team and spent a significant amount of time with us brainstorming and sharing ideas. Also, Rillis Eklund, who was also part of our core team, who's a public health nurse with St. Louis County and a subject matter expert on HIV. We also had a handful of subject matter experts who advised the team throughout the project. Jean Larson, who's an HIV nurse specialist with MDH. Ellen Hill, the Northeast Regional District epidemiologist with MDH. Cedar Savage, the Infectious Disease American Indian Liaison with MDH. And Dr. Jamie Conniff, who is a physician with Fond du Lac Human Services. I wanted to touch briefly on the infrastructure grant. This is the grant that provided funding for this project. It's also the grant that provides funding for my position and Jenna Olson's position. And so in 2021, the Minnesota legislature provided a $6 million appropriation for local and tribal health departments to carry out the work of strengthening Minnesota's public health system post-COVID. And so all of the projects that are funded under the infrastructure grant provide insight into the most efficient and effective way to assure public health has the expertise, skills, and capabilities that it needs to meet new and emerging public health challenges. And the timeline for this project was very quick. We actually made the initial request for additional funds in January. And after doing some planning and sending in a proposal, we were awarded the funds on March 10th. And then we had to actually have the funds spent by June 30th. And this was a huge challenge for our project because our total budget for the project was $127,000. And so it was an ambitious project for the amount of time that we had. Now I'm going to turn the rest of the slides over to Jenna Olson, who's going to talk about communication.
Hi everyone, I'm Jenna Olson, Public Health Communications Coordinator with the Carlton-Cook-Lake-St. Louis Community Health Board. So I support those 4 counties with a variety of communication projects and needs, and I was really lucky to be able to work on this project with Anne and with our partners at AICHO and Fond du Lac. So we had a few sort of goals around communication for this campaign that we wanted to increase awareness of risks and resources and prevention and treatment options for folks who are living with HIV or are at risk of contracting HIV. But we also wanted to increase awareness sort of more broadly, more generally, among folks who maybe don't know that HIV is an ongoing issue and that we have an outbreak going on in our region. We also wanted to destigmatize HIV. So those were kind of some really specific communication goals, but the funding for this project, the infrastructure grant, really also encourages, it was sort of centered around innovation and trying new things and looking for new ways to carry out the work of public health. And for this project specifically, we were looking at community partnership development and communications and trying new strategies around that. So I'm just going to walk through a couple of the broad strategies that we used, and then I'll hand it over to Sasheen, who has a lot more things to say, more in depth, and she'll walk you through sort of how these strategies played out. But just sort of so you can kind of keep these in mind as we talk about the specifics of the project. A main strategy that we used was to lead with art, and that I think a lot of us have had an experience with art where you kind of can make an immediate connection. That first glance can be so quick. Art can convey meaning really quickly, provide that emotional engagement, connects to our memories, our experiences. It can be really responsive to our personal experiences and responsive to our lived experiences. And if you're interested in looking into using art in public health further, the University of Florida Center for Arts and Medicine has a evidence-based framework on using arts and culture in public health that I was not aware of before we started this project. The sort of thrust for engaging with an artist came from AICHO and from Sasheen, who brought this option up early on in our brainstorming. But it does line up really well with this evidence-based framework. So take a look at that sometime if you're interested. Another strategy was just to tailor channels to the audience that we were trying to reach. So looking at do we want digital, social media or physical ads, or radio, TV, like how are we going to reach the people we want to reach? And in order to do that really well, we knew we needed to tap into our community partner knowledge, because we know that there are folks at AICHO, at Fond du Lac, and I'm sure in other places as well, but these were the community partners that we worked really closely with, and they have a lot of on the ground knowledge and experience doing outreach. And so working with them really allowed us to find the right avenues for our messages and really meet the audience where they are. A couple of strategies around community partnership development was to really plan and design the project with our partners from the beginning, to start together and bring our areas of expertise together, value those areas of expertise equally, and you know, be open to all of these ideas at the beginning, sort of to start with a blank slate and ask questions of our partners about what strategies we should employ and how we should go about talking about HIV and trying to, you know, bring this information to the community. Another piece of that partnership was considering compensation. So we were really lucky in this project to have the funds to compensate our partners for their time and their expertise. And so it's something I think that we thought was really important, to make sure that we were valuing what they were bringing to the project. And we also, this next piece, dividing labor and leveraging strengths, really wasn't something that I recall ever talking about at the beginning, but as we sort of talked about it at the end of our project and debriefed, this came up, that this sort of organically happened for us, that the labor was really divided in line with our organizational sort of strengths and systems, so that some of us were doing kind of behind the scenes work of planning and developing some of the materials, and others had you already had systems in place for reaching the folks on the ground that we were trying to reach. And so being able to leverage those strengths really worked out well for us. And it helped us sort of amplify work that our partners were already doing. Another thing to note is that we found it was really important to develop some internal relationships as well. So like within the structure of St. Louis County, to really rely on, you know, folks in purchasing and in contracting and financial services, and having relationships with those people was really essential, especially considering the short timeline that we were working with. We needed to expedite a lot, and having those relationships was really valuable. I also just wanted to note that some of these strategies, you know, it was a communication project, but communication and community partnership development were really intertwined. It was kind of hard to pull those two pieces apart from each other, because we relied so much on our community partners to understand how to communicate with the people that we wanted to reach. So a couple of strategies that really incorporate both of these was that bringing a gift. So we had swag bags and t-shirts that we handed out to folks in the community, and the items in the swag bags, we wanted things that would be useful to our audience. One group of folks we knew we needed to reach were unhoused people, and so having items that were useful to them, that they could take and use and be valuable, but also thinking about this as a way to give a gift, to honor folks, to really value the whole person and connect with them. And one of our hopes for the campaign was to increase awareness around testing. Why is it important to get tested for HIV? How do you get a test? Where do you get a test? So that's like a call to action, right? We want you to get tested, but people are a lot more likely to hear and act on that call to action when they feel valued and heard and respected. And so the swag bags and the t-shirts that we gave out are really, in part, a way to honor folks, to value them, to show that they matter, their health matters, and also to build trust, because we know that when people trust you, they're a lot more likely to take that action that you're asking them to take and get the test. And they also really became, they allowed community members to become messengers for the campaign. They're wearing the t-shirts, wearing the bags around in the community, and other folks, saw that, and it's like walking out advertisements, right? And I heard a couple of stories from people who were on the outreach team, who talked about, sometimes somebody might be really hesitant to take a shirt or take a bag because it says HIV on it. There's that stigma. But there were times when people would say no at first and then walk away, and then they would see t-shirts out in the community. They would see people with these red bags, and they'd come back and say, you know what, actually, I will take one. So that was just, destigmatization in action by way of these trusted messengers who were embedded in the community already. And a couple of other trusted messengers were Shanchoza, artist who we were able to commission to create a great piece of art that we used everywhere in this campaign, and Dr. Jamie Conniff from the Minnow Aowen Clinic. Folks who already have connections to the community, sort of lending their trust and their credibility to the work. Okay, so there's a little bit of an interactive piece we're going to ask you to engage in with us here. So if you would, you can take your phone and scan this QR code, or you can go to slido.com and enter this code here and tell us what makes us collaboration successful, in your opinion. And so go ahead and take a minute and do this, and then I'm going to hand things over to Sasheen to take it from here and talk a little bit more about this collaboration and partnership. In communication, trust, that's a big one. Multiple people put that. Transparency, understanding. A few people are still typing, but Sasheen, I'll hand it to you whenever you're ready.
This is really cool to see this interactive poll because these are the exact same things that we integrated into this project, and seeing trust like that large is exactly what great teamwork makes. You can't be a great team without trust. So that's really cool to see that. Go ahead and go to the next slide. So partnerships is probably one of my most favorite things to talk about because it's so underrated. But this partnership brought multiple organizations and centers together. So along with AICHO, we had Fond du Lac Human Services, Minnesota Department of Health, St. Louis County, and their public health was on this. Also Lake County and Carlton County and the Community Health Board. But together we were able to use like all different kinds of skills and bring it to one table together. And that's one thing I really wanted to highlight. So this week I've been really thinking about like partnerships, like what does that mean? And one thing that we really did well in this project is we sat at this table together. Often what happens is you get invited to a table and it's dominated by someone else, and that's not really collaboration. But what was really cool about this is we all sat at the same table and just threw around ideas and landed on stuff. And I think that's what made like this campaign a big success in such a short amount of time. What we first did was St. Louis County started contacting partners to come in on this project. We had initial planning meetings that, like I just said, we sat down together to talk through ideas. And this was an open forum. Basically, anything went. You could say what you're thinking. We bounced around a lot of ideas to land on what we came up with. And the beautiful thing is like our expertise areas are all over the board. And that's what made this such a beautiful project to work with because it wasn't heavy on public health or it wasn't heavy on community based. What we were able to do was to integrate both of them and be able to do what we do best. Next slide. So a little bit about the messaging. I get super geeky when I see people wearing the t-shirts or the bus driving around, knowing how much work went into this campaign and how many eyes are on it. But the expertise, so community outreach, we have people in disease prevention and control, and then also the processes behind that. So specifically like looking at the public health side of it. The message that we started out with to just get our minds going is you are loved, right? As human beings, like that's the one thing that we really crave is to be seen and to be loved. Based on that is how we came up with our messaging. So as you can see, right on the bottom is one of ours. H is for human, and it's humanizing. We are all human. The problem with stigmatizing literally anything is it's like you're removed from your body, and that's what we didn't want to do. So we use several different mottos on this. On the bus, you can see H is for human, and your health matters. Know your status, get tested. But through these messages, we were able to bring info and resources to populations that were at high risk. And this was destigmatizing the visibility. And that's something that we worked really hard on. It's easy to look at the negative sides of this, right? We're talking about HIV. It's a disease that can kill people. It is killing people. So we worked really hard to destigmatize this so we can talk about it, so we can educate others on it. Next slide. So we contracted with Sean Chosa. He's Turtle Mountain. He is an amazing artist to work with. I'm super excited to be able to talk about his artwork today. When we first started talking about this campaign, it was about like, how do we find an artist that their art says what we're thinking? And immediately with Sean Chosa. His artwork is very vibrant. It sends messages to others. So we're really excited to be able to contract with him on this. So this is the original art piece that Sean has come up with. When developing this, we sat down as a team. We went back and forth on what we envision this campaign being. This is the face of the campaign. And that means, like, when you see this image, what do you think of? So what we want to do right now is to do another little poll. What words or emotions does the art bring up for you? So take a minute to take a look at that. Sorry, go back one more second. And we'll do another poll. Same thing, you can go ahead and scan the QR code. This is uplifting to see these words because these are exactly what we were thinking as we made this campaign. When I think of Native people, I think of these words right here: bravery, encouragement, resilient, peace, love, Indigenous strength. These are all words that we all thought about as this artwork was being created. Next slide. Sean titled this artwork Jabwi, so it's the Ojibwe word for survivor, and how he names work is he thinks about it for a while. He did this beautiful art piece and, you know, sat on it for a couple of weeks, I think, before naming it. And he'll talk a little bit later about why he called it survivor, but that's exactly what it is when you see this image. It's of a Native man. It's a historical image. But he's a survivor in many aspects, and that's why it's named after it. Another thing that comes out of this art piece, you see the red ribbon. That is HIV awareness in the background. Sean was able to incorporate that into the Red Road. So as Native people, we see the Red Road as living purposefully in alignment with our cultural views. We see it as returning to our traditions. We see it as interconnectedness. Each person has their own journey, but many are together on this road. But it also represents our inner strength and resiliency. Next slide. This has probably got to be like the coolest thing. So we were able to get Sean Chosa to talk a little bit about his artwork.
My image is pretty much off of historical photos. So I found a nice historical photo, and then so as you look at the piece, and I think I called it Survivor. That seemed to fit the theme of what they were going for. They didn't want people to be overly depressed and give up hope and not do the things that they could do or have available to them because of depression or fear or whatever social anxiety they may have in getting such a disease. Pick the Indian guy, and I just, you know, that was my reference. But I put a red ribbon over his right shoulder. It kind of trails down behind his head, and it kind of peeks up over his left shoulder. So the red road is more of a comment that I made on it that people picked up on somehow. That's a familiar term in Indian. They embrace themselves in their culture and their history and their religion. That's referred to being on the red road. That means they're living right with all of that. So that trail is the red road. Now, I think my character is he looks like he's in shock a little bit maybe, or like he's a little zoned out. And that's how I imagine I would feel if I had come upon a disease like that and wasn't sure what the future would hold for me and if I'd want to be a part of it. There's so much stigmata that comes with that. Survivor, if you look at the piece, you know, survivor fits, because that's ultimately what we want for these people. We want them to survive and not give up hope and just let this stuff consume them and you know, okay, I have this thing now I have a support network. It was a great campaign. I had a lot of fun. Everybody was very cool and respectful and attentive to any questions or needs that I have. It was a nice paycheck and an opportunity, and I appreciate it. And I'm here for the next challenge if they have it.
Next slide. A part of what made this campaign so successful was the outreach, right? So we have this great image, and what were we going to do with it? This was a really great part of the collaboration. We were able to use a whole bunch of ideas and come up with really great material to get out to the community. One of them is a t-shirt. You've probably seen it around. I see it quite a bit. We were able to get 2,500 t-shirts to give out free to community members with our message on it. And these were high quality t-shirts. We wanted people to wear them and to wear them often. It's like a walking billboard pretty much. It was able to destigmatize to destigmatize HIV, you know, in everyday life, just walking around. And one thing we noticed was solidarity. So people were skeptical at first to have stuff that said HIV on it. And what happens is when one person wears it, another person does, and then another person does. And next thing we know, it's normal to be able to just talk about this type of stuff. I just saw someone wearing this t-shirt on Monday on Indigenous Peoples Day. And I was completely nerdy about it. And I think I scared the guy a little bit. And I was on campus, and he was coming to meet up at the American Indian Center for one of their activities. And immediately I pointed to the shirt without saying anything because I was just so dang excited to see someone wearing it like as a normal shirt. And he got like really nervous and was like, "What?" I was like, my shirt. He's like, "I got this shirt for free at the da-da-da-da-da." I was like, "Oh no, that's not what I meant. I worked on the campaign on that." And it's freaking cool to see someone in everyday life, you know, valuing that t-shirt, wearing that message. And on Indigenous Peoples Day was really cool too. Next slide. Here's a couple images of outreach events that we were able to do stuff at. So we hit up like a lot of powwows. One of these is from the library. You can see, we also had swag bags. So you can see what was in the swag bags. We'll talk a little bit about that stuff later on. Also at our AICHO's Minobamatazi fair, there's a picture from that, and also our art market. A lot of our supplies made it out to different community events throughout the summer. Renelle is one of AICHO's outreach workers. She was so excited to be able to come back after going to an event and tell me what happened. The stuff that she noticed, the things that people said, and it was really cool. So here's a clip of her talking about her experiences.
Hi, my name's Renelle Houle. I am an outreach worker at AICHO, and I table at two different locations, Damiano and the Duluth Public Library. And usually when I go to my destinations, I run into a few people on a regular basis, and I hand them each a HIV bag. And they usually tell me that whatever they don't use, they give out to people who might need them.
Yeah. Well, thank you, Sasheen. And yeah, I love watching that video of Renelle. It's so wholesome, and you can just tell she actually enjoys doing the outreach, which is great. So, once again, my name is Donovan Doffing, and I'm a temporary worker with St. Louis County's Public Health Department through AmeriCorps. And I had the opportunity to help out a pretty great deal with this project. And I'm going to be talking about some of the communication channels we utilize to you guys. So, initially, with starting off the project, we knew we had to put out some sort of press release. So we all kind of worked together to form that. And a huge thank you to Dana Kazel from St. Louis County Public Health as well, who works with our communications. And she really helped us put this together and disperse it. So this press release went out to local media outlets, community partners, and then we also posted it on our website and our social medias. And I believe the same goes for all of the collaborators on this grant, so AICHO and Fond du Lac as well. And then we knew when we were planning out how to raise awareness and decrease stigma that we needed to have advertisement in the community. So we decided to go with some main advertisements. So we did billboards, bus wraps, banners, posters, and digital displays. So a little more detail about each. The billboards and the bus wraps were definitely our largest ventures in advertising, impression-wise and financial-wise. And so we can see some of the billboards there. We have one on I-35, right as you kind of get into the Duluth area. Some of you guys may have seen any of these around the community. And then we have two more, one on East 2nd Street and one on East 1st Street. And the two smaller ones on the East 2nd, East 1st Street are up for 6 months. And then the one on I-35 is up for 4 months. So moving on to our bus wraps. So we went through the Duluth Transit Authority to secure these bus wraps, and they had a really, really great reach. So buses are driving around parts of Duluth and the southern part of our county almost all day. So we really wanted to make sure we included these, and our bus wraps and interior wraps are up until December 15th of 2023 for a total of a 6-month period of advertisement with them. So the external, the bigger outer bus wrap that you see in the picture below, that is actually called a mini King Kong, they call it. And we have 5 of those going around the community. And those have gained estimated 1,515,475 impressions on community members per month. And then what you see on the interior ceiling advertisement, those are just the ceiling wraps. And we, on this and even on the external wraps, we really wanted to include like all the messaging we came up with as a group from the beginning. And we are happy to say that we did so. So a lot of all the main key messaging and key advertising we included on these. So for our ceiling impressions, we had 38,000 per month. So for the whole 6-month span of this bus ad campaign, it's estimated we will make 9,320,850 impressions on community members during the span of the campaign. So moving on, I'm going to talk a little about the swag bags. So the swag bags are probably my favorite part of the project. I was given the opportunity to kind of organize how we're going to pack these swag bags once we got all of our materials in. So we started off with 2,500 HIV swag bags to pack, and they contained, of course, the bag or cinch sack itself with the art that is also created by Sean Chosa. And then it also contains socks, deodorant, shampoo, conditioner, body soap, a condom, and then a sticker including the art that Sean Chosa created, and then a sticker including the QR code, which leads to our website we created for the campaign called stophivnorthland.org. So you can see kind of there on the slide, we have a few pictures. The picture on the right is just the bag, and then a nicely laid out image of the contents of the bag. And then we see the QR code sticker blown up there. So if you want, you can scan that and check out the website now, but we will be talking about the website a little later in the presentation. And then you see below a picture of a past AmeriCorps member, Emily, tabling the HIV shirt and some of the resources at Sidewalk Days this summer.
And for like methodology behind these swag bags too, I've been thinking a lot about qualitative and quantitative research recently. And I would say this is more qualitative. So the thing about partnerships is that we were able to do what we do best and then combine it. And so AICHO does a lot of groundwork, and that means like being out in the community and just naturally getting feedback. We didn't necessarily ask for this kind of feedback. It just happens over time, and people talk about what their needs are and what they'd like to see in the future and stuff like that. So just based on that, over the last couple of years of just learning what our community members in the area would like to see, what they'd like to receive, we were able to incorporate that into these swag bags. And so a lot of these items, they're geared towards a specific population to help them out.
Yes, thank you, Sasheen. So moving on next to another channel of communication we utilized were educational materials. And we tried to create all of these materials using kind of the same theme and color scheme so they'd be easily identifiable. And we created all of these resources tailored for print, so in-hand use, as well as virtual use. So you see the what is HIV and how is it spread material. That's actually tailored to fit the dimensions of a Facebook post. And then an Instagram post is pretty similar to that, but just a little more of a completely even square other than a rectangle. But something we do note with some of our education is that it is recommended to be tested for HIV once in your life, no matter who you are, while you are between the ages of 13 and 64. If someone is at greater risk for HIV, we do then say, please refer to your healthcare provider. And I just want to note one of the resources that you see there that says Duluth Area Services. That is the backside of probably my favorite HIV educational material that came from this campaign. That one was actually created by one of our public health nurses, Rillis Eklund. And I love the way that she utilized that chart to show the location and the resources that each organization offers in terms of HIV response and resources. And so it's really cut and dry on where you need to go if you're looking for a certain resource, which that process could always be way more clear for anyone in the community. So also something to note, all of our educational materials can also be found and downloaded as a PDF, is my understanding, from our StopHIVNorthland.org website. So if you are interested in taking a deeper look at any of these materials, feel free to check them out on the website. So then our target outreach locations. In the beginning of our project planning and just the initial brainstorming meetings, we were like, where do we give our outreach to? Where would it be best to distribute these resources to? So we kind of came up with a list that you see on the left there for our target outreach locations. And then all of our actual locations we were able to do outreach and distribute our campaign resources at is on the right there. And you also see a QR code there. So if you scan that QR code, it brings you to an interactive map app or program that one of our colleagues, Rob Prost at St. Louis County Public Health, who works in data analytics, created for us. So feel free to scan that QR code as well and kind of play around with the map. There's a couple data charts you can look at as well, just about which organization distributed where, and then the locations of where it was distributed. But next, we're going to be looking at a little video from one of our trusted providers, Jamie Conniff, who is a healthcare provider on the Fond du Lac Reservation. And this video is actually part of a series that we created, which was pushed out on Facebook as paid advertisement. So yeah, take it away, Jamie.
I think for prevention of HIV, the most important thing to know is that it is possible to prevent HIV transmission. Somebody who is living with HIV, but whose viral load, the amount of virus in their body, is undetectable, that person is really not able to spread HIV to another person also. So another big part of reducing the risk of transmission of HIV, preventing HIV transmission, is making sure that people who are living with HIV are connected to and have access to treatment that helps them suppress those viral loads.
So I'll jump in and share just a little bit more about how we handled social media and sharing some of this information on those platforms. So the video you just saw, like Donovan mentioned, was one in a series, and so we use that as a paid advertising so that we could target, the folks that we really wanted to reach with this information. So we used Facebook and Instagram for that, and as well as Google Ads. You'll also see on this chart at the bottom, Grindr and Adam for Adam, which are both dating apps. And MDH, the Minnesota Department of Health, sort of gave us the suggestion that we could use those as one way to reach some folks in the LGBTQI community. And this is sort of new territory for us a little bit. We haven't done a lot of social media campaigns like this. So it was really exciting to see the kind of data that we could get back from these ads. You can see, so impressions, an impression is anytime someone sees an ad, anytime it shows up in a feed, anytime you see a bus, you can see how many folks had access to see these ads, and then an interaction would be anytime someone clicks on it or anytime someone views an extended portion of the video or the whole video. And anytime someone clicked on the ads, it would lead them to stophivnorthland.org, the website that we put up. So we felt like this was worth sharing because if you take a look at this cost here too, it's really a lot of bang for your buck. You can get this information to a lot of folks for not a huge amount of advertising dollars. And so that was one venue, and we knew that not everybody had access to phones and computers, and not everybody wants to receive information that way. So it was just sort of one piece of our campaign that was in a companion piece to all of the physical ads on billboards and buses and the materials that we tried to get out into the community. And I'll just give you a quick glimpse at, oh, here's the website again. So over 5,000 views since May 12th. So we're feeling pretty good about the number of people that have been getting to our website and having access to all the resources there. Here's a quick look at just some of the stuff that some of the ads that we put out on Facebook. So on the left here, we created some original content to post, and then we also put out some paid advertisement so we could push those out to folks that we could target this by zip code, by some demographic factors, and some of these ads we were able to get from the Minnesota Department of Health and from the Centers for Disease Control, who already had campaign materials available for anyone to use, and that was really helpful and fit well with our campaign. And so here's some of those groups that we wanted to reach with these ads. We had some. You're looking here at a little snapshot of the chart that we put together so that we could put targeted ad groups, right? So that women would see ads that are more relevant to women, and et cetera. And I know we're don't have a lot of time left, and we want to leave some room for questions. So I think we just have a few takeaways to share, and then we'll hopefully have a few minutes for questions at the end. I guess I'll just start with my big takeaway, and then I'll leave it to Sasheen and Anna and Donovan. I think we maybe all have a takeaway to share, but in the initial planning meeting, when we first sat down, well, virtually, we Zoomed with our partners. Leanne, the executive director of AICHO, was there at that meeting, and one thing that she said really shifted how I was thinking about this campaign, because we were talking about, like, what do we want people to know? What is the message we want to give people? And the first thing she said was, "You are loved." And that was like, made me really step back, right? Because I was sort of thinking about get tested, right? Like, take this action. You got to take care of your health, get tested, do these things. But to step back and say, you're loved, your health matters. And that is the sort of opening point, or the connection point, right? That before we ask someone to take an action, make sure that you're looking at them as a human being, valuing them, and connecting with them on that emotional level, and helping them feel valued. So that's all I have, but I'll leave it to some of my partners here to share their takeaways too.
I can share that one of my biggest takeaways from this project was the importance of developing and fostering internal and external partnerships. And it's best to do that before projects arise, right? We had a partnership with AICHO from COVID, from a lot of our work in COVID, but it's really helpful to work together and just get to know each other so that trust can be built up prior to doing projects. And I would also say, for me, I was the project manager on this project, and so I did a lot of things like contracting and purchasing for this project, and having those internal relationships was very important as well, because I needed to move things along very quickly in this project. And I feel like if I didn't have those partnerships ahead of time, it would have been a lot more challenging for me to be able to kind of pull this off. So I think that's an important takeaway, and something that we should kind of always be doing, especially in public health, is just connecting with our partners, and really it being a partnership, right? There's give and take in a partnership. It's not just us telling people what to do or them telling us what to do. So really building those partnerships up was an important takeaway for me.
And bouncing off of what Anne said too, takeaway for me is that we're stronger together. Right? Individually, we could have each gone after, done a campaign, tried to do a campaign like this, but I don't think it would have come out like this. But we really are. And we really pulled from all of our strengths though. And that's like the true importance of teamwork. And like that one poll said, trust, right? I keep going back to trust because I trusted my team on this. We trusted each other to come up with these and to execute it and to make a difference in this community. And that's exactly what we're doing.
Yeah, very well said. And I'd have to say my takeaway is just staying open to possibility. I mean, I'm a very fresh 23-year-old temporary worker, and I do have a public health background from the University of Minnesota Duluth's program. But I mean, there were a lot of things in this project that I never really saw myself doing and didn't think I'd be able to do. Like, I had a decent hand in creating the initial budget, and I had never done that before. And by the time I finished it, I was like, this is a lot of money we're talking about here. But it ended up all working out. And, you know, like, it was a very short time. I truthfully wasn't sure if we could get all of this done, all the money spent in that short amount of time. But we pulled it off. And again, just going back to trust, we trusted it and we trusted each other that we were going to hit our objectives, hit our deliverables. And if any bumps in the road did come up, I feel like they were handled and smoothed over very, very quickly. So yeah, I guess just food for thought. Like, you never really know what you're capable of until you kind of just step up to the plate with it, and just trust in your collaborators and your teammates in a sense too. But just very happy to have been a part of this, and just thank you, AICHO, for having us to present today. So if with that, I believe we're done with the takeaways. So if anyone does have any questions they would like to ask right now, we're open.
Yes, this is Ivy Vineo from AICHO, and on behalf of AICHO, we're very, very honored and want to say Chimigwich, big thank you to all of you with this partnership to create this outreach campaign on this very important health issue in our community, and all the work that you did in such a short amount of time. It's so impressive, and those numbers are really impressive. And so we are going to open this up to questions, and if people have questions in the chat, or if you have questions, please put them in the chat. I do have, I'll start us out real quick. We have about a few minutes here for question and answer. So my question is, or I guess my comments are, like some of you have said in the presentation of seeing the t-shirts on community members, and sometimes it's unexpected. Like, I was driving in West End, and I saw this big biker guy working on his motorcycle, and he had the shirt on, and I was like, oh my goodness, that's so cool. And then all the bus signage and all that, it just kind of fills my heart and everything with goodness to see that happening. And I love the educational material that you shared. How was that shared? Besides the online approach? And then my final question is, do you have a sense of how many people have been impacted to the point of going in to get tested?
I think I can answer those questions. We shared those educational materials at tabling events as well. So you're able to print off the PDFs, and I'm not sure that they went to all the tabling events, but the intention was that they could be printed and brought to tabling events. They're on the website, so people can download them off the website. or print them from the website as well. And then, we don't know. Jenna and I were meeting with our Northeast Regional Epidemiologist this morning, talking about if we had any idea of how this campaign impacted testing numbers. And we don't. And we wish we had kind of checked that out at the beginning so that we could evaluate that piece. But I think it was with the timeline and everything, we didn't really have time to kind of put those numbers together.
Okay, thank you. We have some comments in the chat. Great work, all. I'm wearing my shirt at work today. Thanks, Amber, Miigwech. Beautiful collaboration. Thank you for the education. Great teamwork, all. Miigwech Kelly, and then Anna Klunk, who is an amazing upcoming physician who spent some time at the Minoiwan Clinic. Amazing work. I know the project was given a very short timeline, but how do you see this continuing in the future with the tremendous impact you have already made? Miigwech Anna.
I can take this one. So I think this collaboration just scratched the surface of what is capable of, right? Even though I think to us this feels like a really big project, but in reality it's like a little peanut, but it is just starting, right? We just now saw what we're capable of doing and the impact that we can have on people, and it's going to be building off of that. And I think, like, if you think about how you make a difference or how you impact people, you're always going for it, right? And so we don't know what is going to come out of this, but I can guarantee you this is the start of whatever comes next.
Yeah, I would add to that and say, this, Anne and I, both of our positions we're doing work under this infrastructure grant that's also funded this project. And we're looking for, part of this work is we want to find new ways to do public health work, so that we're modernizing and we're keeping up with sort of the shifts in our culture and our technology and the ways that we work together. And so I learned so much from this project, and I would just echo what Sasheen said, that it's just the beginning. And then I hope that we'll be able to continue to partner with AICHO and Fond du Lac, but also use what we learned here in our partnerships with other community organizations and continue projects like this.
Miigwech. Anybody else? Just we're a little bit over time, but we'll take a couple minutes to get in some other questions if there are any other questions. So I guess there isn't any other questions. So again, Miigwech, Sasheen, Donovan, Jenna, and Anne for joining us today and for your collaborative important work that you've done with this campaign. And we're looking forward into the future to see what happens next. And Miigwech for looking out for our communities. One note, this is recorded. So after this session, it will be uploaded to our AICHO YouTube channel. And so feel free to share that. I will share that out to all the registrants. I think we had around 60 people registered for this. And I will send that out to them. And but feel free, anybody that is on here now, to share. It was very insightful, and we're really grateful. So Miigwech, everybody have a great day, and be well. Thanks for joining us. All right.